I'm Dr. Jeff Donovan. I'm a dermatologist based in Vancouver. I would like to thank you for listening to this video and this update on alopecia areata treatments. And what I'd like to focus on today is what's new in the last 12 months. There certainly are a lot of exciting changes in the treatment of alopecia areata and also in the basic research into causes of alopecia areata and the genes that govern one's risk of developing alopecia areata and how the alopecia areata presents. So a tremendous body of research has really moved this field forward. And what I'd like to review today is 5 studies from the past year that have played a significant role in the types of thinking that goes on in my clinic. And I will focus on 5 specific studies. I don't have any conflicts of interest on anything I'm going to talk about today. Studies that I've chosen from the research literature from the last year. These are 5 particular studies that have played an important role in the type of thinking that goes on in my hair clinic and the type of thinking that has changed the way that I treat alopecia areata and changed the array of options that we now offer to patients. Years ago, if you had asked if cholesterol medications would be on the list of alopecia areata treatments, I probably would have said that there wasn't a lot of evidence to support that comment. But we've now come to understand that cholesterol medications can not only help fight cholesterol, but they can reduce inflammation, and alopecia areata is a disease of inflammation. Platelet-rich plasma is a treatment that has been used for years by orthopedic physicians, sports medicine physicians, and over the last few years, platelet-rich plasma has been shown to have a benefit in alopecia areata, and we'll talk about that today. Glaucoma medications are used for treating a condition whereby increased pressures are found in the eye. But quite remarkably, these medications can also stimulate hair growth. And we'll come to understand how these glaucoma medications are being increasingly used in patients with alopecia areata. The 4th study that I will review with you today is a study looking at steroid injections and how these compare to topical steroids. These studies really support the notion that steroid injections are better, and we've long believed that this was the case, but this very nice study that I will review shows this quite convincingly. And I'll finish with discussion of 2 drugs called the JAK inhibitors. The JAK inhibitors, tofacitinib and ruxolitinib, are revolutionary medicines that have now come to be on the list of treatments that are potentially effective for alopecia areata. Tofacitinib is a JAK inhibitor that is used for the treatment of rheumatoid arthritis. Ruxolitinib is a JAK inhibitor that's used for the treatment of a bone cancer known as myelofibrosis. And these 2 drugs have now found their way into the hair clinic for patients with alopecia areata, and we'll review these remarkable studies today. So let's begin then by talking about these cholesterol medications and gain a better understanding of how cholesterol medications have now come to be researched for their role in alopecia areata. Listeners of this video are probably familiar with many cholesterol medications, and you're probably more familiar with the trade names than the generic names. Names like Lipitor, Pravachol, Crestor, these are indeed now household names, as cholesterol medications are very, very common. But what we've come to understand is that these medications are useful not only in treating cholesterol problems, but also in reducing inflammation. And this is really quite remarkable. Alopecia areata is an autoimmune condition whereby inflammation develops in the skin at the bottom of the hair follicle, and this inflammation causes the hair to fall out. In the presence of that inflammation, the normal hair follicle processes cannot go on. Normal hair growth is not supported when this inflammation is present. So whenever a medication arises that has the potential to reduce inflammation, there certainly exists the possibility that it could be useful in alopecia areata. But not all medications that reduce inflammation actually have a benefit. A good example of this is the non-steroidal anti-inflammatories, the ibuprofens and the Advils, the Motrins that we're all familiar with. These reduce inflammation, but they don't have a benefit in alopecia areata. So it has to be a specific mechanism by which the inflammation is reduced. And so simply knowing that statins reduce inflammation doesn't mean that they're going to be useful. So studies need to be done, and indeed they have recently been done. I'd like to introduce you here to a very interesting study which was published in the Journal of the American Academy of Dermatology, which looked at these two cholesterol medications, simvastatin and ezetimibe. These are medications which are common in patients which have high cholesterol. But this was a study whereby 19 patients with alopecia areata with no cholesterol problems were treated with these cholesterol medications for a period of 24 weeks. And quite remarkably, about 3/4 or 75% of these patients improved their hair with these cholesterol medications taken by mouth. Stopping these medications led to hair loss in a significant proportion of patients, which gives further support to the fact that these medications were directly responsible for the hair growth that was observed. So a very exciting study, a small study, a preliminary study, but a study nevertheless which supports a role for these cholesterol medications, and a study that has prompted me to introduce these medications into the clinic, and certainly I do use cholesterol medications in a small proportion of patients. What about platelet-rich plasma? Well, platelet-rich plasma is a treatment whereby a patient's blood is taken, and then that blood is introduced into a machine and spun down in order to obtain a fraction of the blood called platelet-rich plasma. And platelet-rich plasma has been used for many years in orthopedic medicine, in sports medicine, to treat ligament and tendon and joint problems. And any of your favorite sports stars, be they basketball players, hockey, tennis, any of these stars with ligament or tendon problems or even joint problems, a good proportion of them have had PRP injections as a mechanism of healing those injuries. But several years ago, the concept was raised as to whether PRP could be used in the treatment of hair loss. And about 6 or 7 years ago, some of the first studies started to be done with PRP in hair loss. This slide shows a machine which is used for processing blood in patients that are undergoing PRP or platelet-rich plasma treatments. Generally, a patient comes into the clinic and my nurse would take 60 to 120 mils of blood. This blood is then introduced into the machine in these bags, which can be seen on the right side of the slide. This machine then spins the blood, and what comes out is about 2 to 6 milliliters of platelet-rich plasma. And that PRP comes out in the syringe, which can be seen in the middle of the slide. And when injected into the scalp of individuals with alopecia areata, this PRP can be beneficial. PRP, or this portion or fraction of blood, is known to contain many growth factors. In fact, 10, 11, 12 different growth factors. And a number of studies now have shown that PRP can be beneficial in alopecia areata. And one of the best studies was a study published 2 or 3 years ago in the British Journal of Dermatology, which showed that platelet-rich plasma injections in patients with patches of alopecia areata was fairly similar in its efficacy to low-dose steroid injections. And so PRP has now come on to the lists of potential treatments in alopecia areata. We too have an interest in PRP in alopecia areata and have undertaken several studies to better understand how this treatment benefits patients. This is a patient with alopecia areata affecting the back of the scalp, which we call the ophiasis position. Now, this individual had received steroid injections, but then proceeded to PRP as another option for treating her alopecia areata. And what you can see on the slide on the right side is a significant increase in hair growth, regrowth after PRP injections. And we have published these findings as well in the Journal of the American Academy of Dermatology case reports. Glaucoma medications are also a treatment for alopecia areata, and recent studies have continued to support a role for these medications in treating alopecia areata. Glaucoma medications are medications used to treat the increased eye pressures that happen in patients with an eye disease known as glaucoma. And several years ago it was discovered that these particular eye drops can stimulate hair growth. And so many individuals that were using these glaucoma eye drops were growing longer eyelashes. And this led to the patent and marketing of these glaucoma eye drops for hair growth treatments. Many listeners may be familiar with the product Latisse. Latisse is a pharmaceutical product which is the exact same ingredient as these glaucoma eye drops. Latisse is applied with brushes, which you can see in the slide, and it's applied to the upper eyelid at night. And so when the individual closes the eyes, the upper eyelid and lower eyelid are in very close proximity, and this leads to stimulation of hair growth of the eyelashes on both the upper eyelid and lower eyelid. And this ingredient, bimatoprost, is the same ingredient used in the glaucoma eye drops. And so bimatoprost has a role not only in helping reduce eye pressures in patients with glaucoma, but has a role in stimulating hair growth. Now, bimatoprost has been used for many years for women who desire longer eyelashes. But more recently, it's been understood that bimatoprost can also have a benefit specifically in patients with alopecia areata. And it's been shown that bimatoprost can help trigger eyelash growth, especially in patients that have some eyelashes remaining, and is also used in the clinic in promoting eyebrow hair regrowth as well in patients with alopecia areata. These are off-label treatments, meaning that the primary indication for the medication is in glaucoma and in promoting eyelash elongation in individuals with reduced eyelash growth, but they can be used in alopecia. The next study I'd like to discuss with you has been the source of some uncertainty. It has been known for quite a long time that bimatoprost topical solutions, especially this commercially available Latisse solution, can be used for treating eyebrow and eyelash loss in individuals with alopecia areata. But what wasn't clear was whether these same bottles, these same small, relatively expensive 3 ml and 5 ml bottles, can be used for treating scalp hair loss. Is this even practical? And so this study from 2016, which was published in the journal Pediatric Dermatology, showed that this is relatively practical. The authors of this study described a 9-year-old female who had used topical minoxidil, topical steroids, steroid injections without improvement, and then went on to use topical bimatoprost. And quite remarkably, the application of topical bimatoprost led to hair growth starting at the first month, followed by quite significantly full growth by month 7. And so this study has really opened up the possibilities for using this topical bimatoprost solution not only for treating eyebrow and eyelash loss in patients with alopecia areata, but also the possibility of scalp hair as well. And it may be that small volumes can still provide significant benefit for scalp hair loss. Next, I'd like to speak to you about some studies looking at topical steroids and steroid injections in the treatment of alopecia areata. The presumption for many years has been that topical steroids are effective, but perhaps not quite as effective as steroid injections. And this study that I'll describe next set up to compare topical steroids and steroid injections to determine really what is more effective. And so the authors of this study set out to compare the results following steroid injections in 113 patients and the results following topical steroid application in another 113 patients. So this study in total involved 226 patients with alopecia areata, one half with steroid injections and one half with topical steroids. And this study showed quite convincingly that individuals that were receiving steroid injections had better hair growth. That's not to say that topical steroids didn't help, because they certainly did. But overall, individuals that were receiving steroid injections had better hair growth. Now this is a observation that we have observed many times in the clinic, and many physicians who treat a lot of patients with alopecia areata are aware of this as well. I like this study because it's a large study and there are well-defined endpoints. Many of the studies in the hair loss world are small in number, and really in order to make appropriate conclusions we need large numbers of patients. And a study with 226 patients is a reasonably large study, which really allows us to draw conclusions that are helpful for us. And finally, we come to the last of these 5 sets of studies. And these are what I consider some of the most revolutionary studies of the last few years, and studies which have really changed the way that we think about alopecia areata and certainly changed the options for patients with alopecia areata, and that is this group of medications called the JAK inhibitors. JAK stands for Janus kinase, and these are pathways within cells that send messages into cells, and 2 drugs, tofacitinib and ruxolitinib, are able to block this pathway, and quite remarkably, as I'll show, have been demonstrated to have benefit in alopecia areata. Tofacitinib is a rheumatoid arthritis drug, and so it's commonly used for patients with advanced rheumatoid arthritis who haven't got better with standard medications. And ruxolitinib is a medication which is currently approved for the treatment of a bone cancer known as myelofibrosis. And so these drugs are on the market. And what I'd like to show now is that these drugs have now been shown to have benefits in alopecia areata. Those of you who follow along the progress in alopecia areata research will no doubt remember the announcement of this study, and that was a study of a mid-20-year-old male who had alopecia areata who had been treated with topical steroids. He then began treatment with tofacitinib, this JAK inhibitor, and the individual was subsequently able to regrow hair with that medication. This caught the attention of the press, and it was certainly a very exciting study, not so much because it was a cure, because it's quite likely that if this individual were to stop his medication that there could be hair loss in the future. So it's not a cure, but rather a new group or a new class of treatments that can be effective for alopecia areata. Now, what we don't know in this patient is if he was treated with diphencyprone, or if he was treated with anthralin or methotrexate or sulfasalazine, or any of the other standard treatments that we had on our list before, would he have also regrown hair? So the treatment doesn't necessarily tell us that this is the most effective treatment for alopecia areata. Doesn't tell us this is the best treatment for alopecia areata. But this study does tell us that these JAK inhibitors are now on the list as treatments that can be effective for alopecia areata. And after that study was published, a number of other studies were also published, which showed benefits not only for tofacitinib but for ruxolitinib. This was a recent study which showed the benefits of ruxolitinib, this other JAK inhibitor drug, in an individual not only with the autoimmune condition alopecia areata, but the autoimmune condition vitiligo, where individuals lose pigment in the skin. But the importance of these studies is mainly centered around the proof of concept, meaning that these studies are important to me because they show that these class of drugs are potentially effective for alopecia areata. I think the one thing which is often forgotten by the public and the press is that these medications do have side effects. Tofacitinib is an immunosuppressant medication. Ruxolitinib is also immunosuppressive medication, has a role in treating cancer. Side effects aren't common with these medications, which is quite remarkable and continues to be very interesting observation. Certainly we use these drugs, mostly tofacitinib, in the clinic, but they are immunosuppressants, and the long-term side effects and long-term consequences of these medications needs to be carefully considered. Rarely these medications can lead to an increased risk of infection. They can affect blood counts, they can irritate the liver, they can affect cholesterol profiles, they can affect the heart. That's very rare, but nevertheless, starting tofacitinib in someone very young is a very, very important consideration and can't be overlooked. And so one of the very, very important concepts is whether these medications can be used topically. Rather than using them as pills, which then circulate throughout the entire body, can these medications be used topically? And studies this year have shown that, in fact, it's quite likely that they can be used topically. This was a study by Craig Lau and Dr. King's group, who've done pioneering studies with tofacitinib and ruxolitinib. And what this study showed was that, in fact, topical ruxolitinib applied to the eyebrows could be effective. This was an individual with alopecia universalis, had the topical ruxolitinib applied to the eyebrows, and subsequently had regrowth to a significant degree after 12 weeks of treatment. And so this really is a proof of principle type study, meaning that we now know that topical JAK inhibitors can be effective. And I think you'll be hearing a lot more about topical JAK inhibitors in the years to come. They are potentially helpful. Larger studies are certainly needed. They are potentially safer. Larger studies are needed, but nevertheless provide a whole new array of options for the treatment of alopecia areata. And I think this is tremendously exciting, and the race is on now to develop these topical JAK inhibitors. So with that, I'd like to conclude. I want to thank you very much for your attention and for taking the time to listen to these research updates from the last year. I've described today the potential roles of cholesterol medications in treating alopecia areata and their role not only in lowering cholesterol but reducing inflammation. We spoke about platelet-rich plasma and how it's moved from the sports medicine clinic now to the hair clinic as a potential treatment. We've talked about these glaucoma medications and how they not only lower eye pressures but stimulate hair growth and may have benefits in eyebrows, eyelashes, and also scalp hair. We talked about the importance of steroid injections and how we really have come to appreciate that steroid injections are much more effective than topical steroids. It doesn't mean steroid injections are for everyone. A 7-year-old with alopecia areata would begin in my clinic with topical steroids rather than steroid injections, given the discomfort of steroid injections. But nevertheless, steroid injections are the way to go for a vast majority of patients with patchy alopecia areata. And finally, we spoke about tofacitinib and ruxolitinib and this whole class of JAK inhibitors. These drugs have really revolutionized the treatments of alopecia areata in terms of introducing a new class of drugs. We haven't had a new class of drugs with such significant benefit for quite a while. We have had on our list prednisone, methotrexate, sulfasalazine, cyclosporin, azathioprine. These are immunosuppressants which are used, but now we have this new group of drugs which appear to have a reasonably good safety profile. More studies are needed, but we'll be hearing a lot more about these drugs in the years ahead. Thank you again for listening. I'm Jeff Donovan, and I appreciate your attention.